Hello everyone, this is Rajamanikam Antonimuthu from QPT. Stanford Medicine researchers devise a new artificial intelligence model, SyntheMol, which creates recipes for chemists to synthesize the drugs in the lab. With nearly 5 million deaths linked to antibiotic resistance globally every year, new ways to combat resistant bacterial strains are urgently needed. Researchers at Stanford Medicine and McMaster University are tackling this problem with generative artificial intelligence. A new model dubbed SyntheMol for synthesizing molecules created structures and chemical recipes for 6 novel drugs aimed at killing resistant strains of Acinetobacter baumannii, one of the leading pathogens responsible for antibacterial resistance-related deaths. The researchers described their model and experimental validation of these new compounds in a study published in the journal Nature Machine Intelligence. Before the advent of generative AI, the same type of artificial intelligence technology that underlies large language models like ChatGPT, researchers had taken different computational approaches to antibiotic development. They used algorithms to scroll through existing drug libraries, identifying those compounds most likely to act against a given pathogen. This technique, which sifted through 100 million known compounds, yielded results but just scratched the surface in finding all the chemical compounds that could have antibacterial properties. People have estimated that there are close to 10 to the power of 60 possible drug-like molecules, so 100 million is nowhere close to covering that entire space. Generative AI's tendency to hallucinate or make up responses out of whole cloth could be a boon when it comes to drug discovery. But previous attempts to generate new drugs with this kind of AI resulted in compounds that would be impossible to make in the real world. The researchers needed to put guardrails around SyntheMol's activity, namely to ensure that any molecules model dreamed up could be synthesized in a lab. The model was trained to construct potential drugs using a library of more than 130,000 molecular building blocks and a set of validated chemical reactions. It generated not only the final compound, but also the steps it took with those building blocks, giving the researchers a set of recipes to produce the drugs. The researchers also trained the model on existing data of different chemicals' antibacterial activity against A. baumannii. With these guidelines and its building block starting set, SyntheMol generated around 25,000 possible antibiotics and the recipes to make them in less than 9 hours. To prevent the bacteria from quickly developing resistance to the new compounds, researchers then filtered the generated compounds to only those that were dissimilar from existing compounds. The researchers chose the 70 compounds with the highest potential to kill the bacterium and worked with the Ukrainian chemical company Inomen to synthesize them. The company was able to efficiently generate 58 of these compounds, 6 of which killed a resistant strain of A. baumannii when researchers tested them in the lab. These new compounds also showed antibacterial activity against other kinds of infectious bacteria prone to antibiotic resistance, including E. coli, Klebsiella pneumoniae, and MRSA. The scientists were able to further test 2 of the 6 compounds for toxicity in mice, as the other 4 didn't dissolve in water. The 2 they tested seemed safe. The next step is to test the drugs in mice infected with A. baumannii to see if they work in a living body. The 6 compounds are vastly different from each other and from existing antibiotics. The researchers don't know how their antibacterial properties work at the molecular level, but exploring those details could yield general principles relevant to other antibiotic development. Thanks for watching this video. Now you can get my ebooks with a huge discount at www.rajamanikam.com by using the discount code QPT. Contact me if you are interested in earning a 50% commission for selling my ebooks and course. Thanks.